Hello everyone, thank you so much for coming in on a Friday afternoon. My name is Dr. Stephanie Moss. I am a PGY2 psychiatry resident at Residency Franklin. We're going to be talking about different lived experiences from a medical perspective, what it looks like to disclose, when to disclose, how to disclose, and actually how to go a step further and actually receive accommodations for your lived experience if that's what you need. I always like to start with disclosures. One, I am a Doximity fellow, so that means I wrote for Doximity. This was last year. I also am a brand ambassador for UWorld, MCAT, and USMLE. Other educational disclosures include now psychiatry, now neurology, Genu Scrubs, White Coat Investor, and Picnonic. And so today I'm going to be sharing my lived experiences as being a Hispanic, heterosexual cis female with invisible disabilities of post-traumatic stress disorder, generalized anxiety disorder, endometriosis, interstitial cystitis, and infertility. Overview, I'll be talking first about the disability in what it looks like to have a disability in medicine from my own perspective. I'll be talking about my journey, the pros and cons of disclosure, how to disclose in applications if you're applying to a job, if you're applying to school, different laws and protections that involve finding a disability-friendly program or organization, and why we need disability in medicine. So what is this word of disabilities? I'm going to share with you more of a formal definition. So first, an individual, and this is by the ADA, an individual with a disability is defined by the Association of Disabilities is a person who has a physical or mental impairment that substantially limits one or more major life activities. A person who has a history or record of such impairment, or a person who is perceived by others as having such an impairment. I'm going to share my definition, which is a bit more inclusive and resonates a bit more with individuals. A physical or mental health condition limiting your ability to do your very best in academics, work environment, relationships, or life in general. So at the end of medical school, every single medical student before you graduate fills out a survey. This is to see about their general experiences in medical school. A very unique question came up in 2021 where they start to ask, do you have a disability? And you can see from 2021, 2022, all the way to last year's most recent, there is an increased amount of medical students in the US who are disclosing that yes, they have a disability. So right now, out of the 16,400 respondents, about 12.7% said yes. That is a huge increase. We don't know if that is because more are accepted or just more are learning they have a disability or that more are willing to disclose on this anonymized report. Next, if you selected yes, it's a computer survey. It will go to the next one and say, okay, what kind of disability do you have? And I like to note the number one disability that is endorsed as medical students is ADHD at 70.7%. That's almost a 7% increase over the past 5 years. Second is a chronic health disability. Third is a psychological disability that includes depression, anxiety, bipolar, any of those psychological conditions. When I was in medical school, I had the experience to take a leave of absence to address my own mental and physical health condition and to take the USMLE exam. What I noticed is I wasn't alone with this experience. There were a lot of other medical students across the country and even in my own medical school for different reasons. So at that point in my medical school, I was a second year student. I created a survey to see, okay, what are the similar challenges that we are experiencing? That then progressed to a most recent survey that we created last year where we had 59 medical students who responded. This is across the country, US, MD, and DO. And some interesting things that we noticed. Almost 50% were Hispanic and Latinx, like myself, and then 38% disclosed a household income of less than 25%. And this is so important because when you take a leave of absence, you now cannot take federal loans. It is not allowed. So students now have to figure out, how in the world am I going to live? How am I going to pay for rent? How am I going to pay for food? If I'm taking leave for USMLE studying, how am I going to pay for those very expensive board exams? So URM, underrepresented medicine, were 80%. 46% were, almost 47%, were due to a first generation status, that they were this is first generation doctor status. So no one in their family was a doctor. 10% said they were a URM because of race, and 18% due to a disability. And then you can see how high there were of those who disclosed that they also had a disability or chronic illness. So this is one of my favorite writers, is Brené Brown. She is a PhD doctor, and she says this in one of her books: there is power to being vulnerable. So that's exactly what I'm going to do right now, in being able to use my words and sharing my vulnerable experience to be able to provide power to those words and provide you in your own lived experience power. My second year of medical school is when I was diagnosed with all these health conditions. Specifically, it is when I started to really struggle with academics, struggle with failures of courses, struggled to pass the step 1 exam. And then working with a therapist and one of my primary care doctors, I was then eventually diagnosed with various conditions that I mentioned before. During my leave of absence, I ended up failing step 1, not just once, but twice, because I was also a part of that group of students that I had no income and had to figure out, how in the world am I going to pay for schooling? I ended up taking multiple part-time and full-time jobs in order to pay. And then, actually, when the first time I failed my USMLE, one of my good friends told me, wait, you just got diagnosed with health conditions? Why don't you apply for USMLE accommodations? And I was taken aback. I was like, one, I've never had a disability. I don't have a disability. And 2, I've never had accommodations before. Why would why would they give it to me if I've never asked for them before? So the summary of this is, disability in my head did not fit. I had a picture in my head of what someone with disabilities and what someone with accommodations looks like. In my head, I didn't fit that mold. And that was preventing me from asking for help. And so that is the reason why I give these presentations, to challenge our brains to reanalyze of what a disability is and who can ask for accommodations. So yes, once I received accommodations, shocker, I passed. Returning to medical school as a clinicals, I also received accommodations now for my clinical rotations for my step 2 exam. I also ended up freezing embryos because my husband and I are both in medicine. So because I was diagnosed with infertility while I was diagnosed with endometriosis, we decided to just go ahead and freeze. So then I give presentations talking about what it means to go through infertility and the IVF preservation during medicine. Very difficult emotionally and physically. And then going to M4 year, because of the various challenges in my medical education, I decided to dual apply to family medicine and psychiatry to increase my chances of actually matching into the specialty, which was psychiatry. I did disclose into applications and interviews, and it's so funny that my program director is here today because he was the first person I actually disclosed to in an interview. Up to this point, I just included it on my application. And it wasn't till right before my Rosalind Franklin interview that I gave a presentation to medical students very similar to this on how to apply to residency, because I was actively in the process. And we had that conversation on disclosure. And I thought to myself, how in the world am I saying how to disclose when I hadn't done it myself? So that same week, I decided to disclose to my now program director, and it worked. Let's actually get to that concept of disclosure. Who, what, when should you disclose? So now I can talk about more the pros and cons. A big thing that when I talk to individuals who are applying and giving the same presentation is trying to determine the pros and cons, because this is exactly what I went through myself when trying to determine the pros and cons. Starting with with pro side. You are being authentic to who you are by being vulnerable. But on the con, there is a lot of social stigma, even more in medicine, sometimes even more in psychiatry. Another pro, you can gain opportunities as a diverse member with a unique skill. Con, you also risk losing opportunities. 3, maybe you're seen as resilient or courageous, but on the other side, you can also be seen as weak, frail, inadequate, vulnerable. Use whatever word that social stigma creates. 4, you might be able to inspire others to share their own stories or to actually form a community. Or you also might experience emotional trauma yourself through being rejected by your peers and coworkers. Pro, you can receive help and resources that you need to be successful. 5, you can also deal with the struggles of medicine, like professionalism. Let's talk about laws and protections. So the ADA actually prohibits employees from asking questions that are likely to reveal the existence of a disability before making a job offer. That is the pre-offer period. So if we're thinking about it, when you're interviewing somewhere, they're not allowed to ask you those specific questions. That includes through questionnaires, medical exams, and this is different than just doing the urine drug screen. That is after. This is before you've actually received an offer. The second part, such questions and medical exams are permitted after the job offer. So that would be after, if we're talking about a medicine, after you've matched in a program, but before the actual work. So including usually the things that are standard is just an HR evaluation, just to make sure you're not like a urine drug screen is usually the most common. Now let's talk about who to disclose to and example questions you can ask other peers or supervisors when you're having these discussions. So in person or virtual, if you have virtual interviews, directly to the person most on the highest level of the food chain. So that'd be a program director, attending, chief, the human resource, so HR department, perfect person to go right to and ask directly about what resources are available, what is offered, how can you be supported. Other ways that you can disclose to and think about, these are things that you can think about disclosing, is your peers and current people in that program or in that job who maybe know more about the culture. And then of course, after you've been offered the job. Some example questions that are pretty vague, but are still can be meaningful, can be, have there been any recent employers who have taken a personal leave or parental leave? You can ask, what happens when someone needs to call out? Is there a backup person? Do other people have to pick up the work? What resources have you provided to other individuals who maybe have struggled with their academics? Those are just a couple. And then you can also go more direct. So this explains they cannot ask you. They cannot ask you, do you have X condition? Do you have X disability? Have you been injured? Have you been treated? Those are things they cannot ask you. But like I mentioned before, there are other things they can talk about. They can ask you to do a medical physical. They can ask you to do a letter from a physician, or just ask in general, how can we support you? What types of reasonable accommodations do you need? Those are appropriate statements that they can provide. These are types of things to look for in a program or a future job. Something that has flexible scheduling, something that has many sick, vacation, days off, flexible calling system if something happens, counseling, therapy assistance, maybe a website or a section on their website of accommodations on their paper that actually says accommodations, providing good health insurance, offers disability insurance. All these different types of things are things to look for. Now let's talk about how do we disclose to patients? Because that is also something I really wanted to evaluate. I spoke with a lot of individuals. Actually, it started off with my podcast where I interviewed a lot of physicians in the field and other health professions who did have health conditions. And I asked them, how do you balance that of being a human with your own experience and working with other people who also have that experience? How do you disclose? Do you not disclose? What types of things do you do? And after doing a lot of that work, I determined a way that I've learned how to appropriately disclose. So, first question to ask yourself is, why am I even disclosing? What is the purpose? If the purpose is for yourself, then that's not appropriate. If the purpose is to help them as a patient to understand that you get what they're saying, and the biggest thing is that you're as general as possible. And this is honestly very similar to talking about before, is you don't have to go into your life story. That's not what it's about. Sometimes it's a 3 to 4 word sentence. And these are literally the types of sentences that I say to my patients. And I don't do it to all patients. Maybe I would say a quarter of my patients. I do it when patients are losing hope and saying, oh, I will never get a job because of this chronic pain. And I state, I have chronic pain too, and I'm a doctor. Like, that usually motivates them quite a bit. They re-look at themselves and be like, oh, so this isn't the end for me. So maybe the purpose is motivation. Maybe the purpose is no one understood them before. So the next one for medications, I'm a psychiatry resident, so a lot of what we do is psychopharmacology. I've had patients that say, no, I can't remember to take my medications every day. And after I've done the other types of medications, like reminders on their phone, and they're still like, I just don't know. I don't think I can do it. What are other people gonna think of me? I even say, no, I get it. I take medications too every morning for my mental health. Boom, that's all I say, but that really stops them and be like, oh, okay, maybe it's not as bad, it's not as big as I'm working it up in my head. So the biggest statement I say is, am I acknowledging a fact, or am I trying to explain myself? If I'm trying to explain myself, it's too much of the me, and that then becomes not appropriate. If I'm saying as I'm just acknowledging a fact to help the patient go forward, that's where it can be to help the therapeutic professional relationship. And also something to recognize is, okay, will this harm how my patient sees us, or being able to work with each other? If it doesn't, then just don't do it. Why we need disability in medicine. So there is this barrier in medicine between patient and physician. And that's been for years. There is a segregation. The physician is the all-knowing, perfect, and this kind of breaks the barrier a little bit by saying, no, physicians, nurses, healthcare providers, and professionals are human too. And once we equal out a little bit and just see them as human, that also will improve the trust that patients have in us. It also helps strengthen trust and communication. I've had patients that talk to me about how much they've been gaslit by providers. No one believes me. No one believes that I'm in pain. And then I say, no, I get it. I had that experience too. I hear you. And so then they're like, oh, okay. You get it too? Okay, now I feel like there's a trust that we can continue and that you won't just ignore me like other individuals have. Also inspire patients of the, if you can do it, I can too. And then also breaks down the barrier of doctors and nurses being superhuman. Now let's look at what is the benefit to medicine. It normalizes disabilities in medicine. It normalizes people using wheelchairs. It normalizes people taking time off to go to their own mental or physical health condition. It normalizes taking time for wellness and mental health. And it's just pushing and improving our culture as a whole of medicine. And it is part of the movement to be able to breaking down stereotypes in medicine themselves. Instead of, I think back to how I thought when my friend told me, oh, you have a health condition, you have disabilities, why don't you ask for help and accommodations? That little box I had in my mind of what it means to be disabled or have a disability, I was not alone. That is very common in medicine. So by showing different types of invisible and visible disabilities in the medical field, we're helping break the barrier to help other physicians and other medical providers to show what it really means to have disabilities. I did it really fast. Because I think I removed a lot of specific of USMLE accommodations. I did it as broad as possible for this. Normally, if I'm presenting to medical students or for resident doctors that are applying for disabilities, I go through different accommodations they can apply for USMLE or COMLEX, or if they're in clinicals, so removed all that. So overall, I didn't say this before, but I do want to mention it now. Disclosure is a very personal choice. Only you yourself can determine if and when and to who you tell. And it doesn't have to be specific. You don't have to tell your life story like if you're going into a doctor's appointment. It can be as general as possible to say, I have health conditions. I have mental health conditions. I have anxiety too. That's it. You don't have to go in as detailed as maybe sometimes we worry that we need to. So in that sense, if you are disclosing to a coworker, to your job, to a patient, be as specific and as general as possible. Keep it need to know. What do they actually need to know for our next steps? What is the purpose? Know the laws, what if you're applying, or even when you're working, what your employer can and cannot ask you. And overall, I do want to say you are needed in medicine because you do provide such a valuable lived experience, and to be able to support the future generations and future patients by by bringing in yourself, being yourself. And something I always mention is like when you're trying to determine whether or not, especially when applicants are like thinking about their match list, I ask them to think about, are they taking just the person you want them to think you are, or all of you? So make sure when you're deciding that, when you actually have the opportunity to have some choice, think about that. Like, where did I feel most comfortable, or that I could be myself or as authentic as I can? These are some important resources that I mentioned. So the adata.org, that is a national network that speaks more about the disability accommodations. I love this Ask Jan website because you can actually go to the specific mental or physical health condition, and it'll provide you a long list of different disability accommodations you can ask for. And it's very specific. It goes like very specific PTSD, bipolar, schizophrenia. So askjan.org. And then the equal employment, that provides more information specifically on what employers can and cannot ask for. So thank you so much. That QR code goes to my website, and there you can look for my podcast. It's called Life as a Patient Doctor, where I interview medical students, physicians, and healthcare professionals about their lived experience in medicine to show their humanity. So thank you so much, and I'm willing to answer questions. Oh, yeah, go ahead.
So if we run across a student maybe struggling and knowing you're here,
I would love to, yes. Please connect them to me, of course, yes. I meet with students all the time, formally and informally. If they're an RFU student, I meet with them as a resident. As a RFU resident, since I'm a co-chief for medical education, I love to meet and advise them and connect them to the appropriate accommodations at RFU. And I've also even connected people with the HR if they're a staff member. If they're outside of RFU, then it's different.
I don't want to burden you, but it's
Thing that I do a lot, so I've definitely, through the grapevine, people always reach out to me for various things like that. Yeah, of course. Even residents, like an internal medicine resident a couple months ago texted me and, hey, I'm struggling. Do you remember you gave us a talk at orientation about mental health? I couldn't remember. It was very easy to just send them the link of this is RFU's HR assistance program. Thank you for asking. I see also in the chat. Thank you, especially people who are virtual. Thank you for joining us.